My name is Leroy Weaver. I'm a diagnostic radiologist at Goshen Health. At Goshen Heart and Vascular Center, we have several screening options that we've made available to our primary physicians. One that we use frequently is the coronary calcium scoring evaluation. The presence of calcium indicates the presence of an atherosclerotic process. A coronary calcium screening test is a test that looks for calcium in your coronary arteries. The test is performed using CT. It's a 30-second exam. You lay on your back, hold your breath. It's painless. It doesn't require an IV. And after the test is complete, you will get a report that has a coronary calcium score. A coronary calcium score of 0 indicates there's no calcium in your coronary arteries. A 0 score is ideal. Depending on what your calcium score is, your doctor may do additional testing. For example, if your calcium score is high. If your calcium score is low to intermediate, your doctor will probably have a conversation with you about lowering cholesterol, dietary changes, lowering your blood pressure. All of these factors affect atherosclerosis, and your doctor will likely have a conversation on how to improve all these. Atherosclerosis is a process by which, over time, that your linings of your vessels will harden, calcify, thicken, and it can affect blood flow to anywhere in your body. In the brain, when that happens, we call it a stroke. In the heart, when that happens, we call it a heart attack or chest pain. In the legs, when that happens, it can cause an ulcer to form. It can cause crampy pain. Those are all related to atherosclerosis or the results of atherosclerosis because of a lack of blood flow. Screening ultrasound test that we have at Goshen Heart and Vascular is a test where we screen blood flow going from the heart to the brain by looking at the carotid arteries. We screen blood flow going from the heart to the lower legs where we look at the aorta. And we also screen blood going from the heart to the ankles by an ankle-brachial index. And then we also do a cursory look at the heart called a screening echocardiogram. The screening echocardiogram evaluates the heart, looking for motion abnormalities and looking at the basic structures of the heart to make sure everything is functioning properly. So a screening test could be obtained at Goshen after a conversation with your physician. The ultrasound screening test is available to the patients at no cost to the patients.